Thank you, Dr. Neha, Sahani sir, and Sahani sir. Good evening, good afternoon, and good morning. This is the 1374th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to the session, and today our guest is Dr. SHRISHAIL from Bangalore. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy was formed during the time of COVID, and it was formed by a group of homeopathic lovers along with the students and homeopathic lovers. And we are conducting regularly 3 sessions in a row. That 7 to 8, we have our Hindi session, 8 to 9, the international session in English, and 9 to 10, local language session in Malayalam. We have present participants from different part of the world, and particularly people from 65 countries have presented the session, and already we have lot of presentations on different subject, and lot of cases were present, successful cases were presented in this forum, and we are uploading almost all to the YouTube so that it will reach to the public also, so that homeopathy will be the winner at last. And that's the purpose of this, and we are able to connect between doctors among the world. Today, we have an excellent guest in Dr. K.B. SHRISHAIL. He has completed his BHMS and MSc Psychology, and his BHMS from SB Shrikoli Homeopathic Medical College, Shankareshwar. And he is presently working as a homeopathy physician and director at Sanjeevani International Homeopathic and Ayurveda, Mandya, Mysuru, and Bangalore. He is a mentor and mission homeopathy at Aditya Homeopathy Hospital, Pune. He has worked there for 1 year. That is, as you know, the Aditya Homeopathy Hospital is run by Dr. Amar Singh Nigam, one of the legend as far as homeopathy is concerned. He is having a very, very big hospital there, having more than 100 bedded patients in this hospital, where Dr. SHRISHAIL has worked for an year. And he has worked in some other part of Bangalore, many more hospitals in Bangalore, as well as he has worked in Mahavir Kidney Transplantation Unit, Hyderabad. So, as you know, he has presented some papers in our sessions in the previous year. At the same date, as you know, the importance of the date is none other than his birthday. So let us celebrate his birthday in this forum, along with all the friends of homeopathy who loves homeopathy, who loves Dr. SHRISHAIL. And really, it's a great opportunity to celebrate your birthday in this forum. Congratulations, and we wish you many, many happy returns of the day, and hope that you can present at least one case during your birthday in this forum every year. We welcome a doctor. And today, Dr. SHRISHAIL will be presenting some of his experiences with homeopathy at surgical cases. As you know, sir, homeopathy can do wonders in surgical cases, and he is a winner at many, many important surgical cases. So let us welcome our birthday boy, I must say, Dr. SHRISHAIL, to the session. Welcome, doctor.
Thank you. Thank you very much, sir. Can you hear me, sir?
Yes, yes. Is there any network problem with you? Yes, there is some problem. Okay. Can you hear me now? I shall make you. Yes, you are co-host now. You please unmute. Okay.
Sir, namaste.
Yes.
Dhanesh sir,
Yes, yes, we can hear you. Can you?
can you hear me, sir?
Yes, yes, we can clearly hear you.
Okay, okay. Is my screen shared?
No. You haven't shared the screen. You just go back and then once again start sharing.
Okay, okay. I think there was a network issue.
That's why. That's why it was stuck for a few
Just
minutes.
sir, screen share ಆಗಿದೆ. share. ಇಲ್ಲ ಇದಕ್ಕೆ share ಆಗುತ್ತೆ. ಇದು screen share ಇದೆ sir.
Take your own time. No need of.
Yeah, yes.
Presentation ಬರುತ್ತಲ್ಲ ಸರ್ ಇಲ್ಲಿ ನಿಮ್ದಿಲ್ಲ.
Yes, it's coming. Yes,
Yes, sir, it's
yes,
there.
yes, it's. Yes, everything fine. You can go ahead.
Yes, sir. Is it full screen?
Yes. It's full screen.
ಅಲ್ಲಿ ಗೊತ್ತಾಗಲ್ಲ. Dr. Dhanesh sir, and I would like to thank to all the homeopathic paternities from the international group.
International Forum for Promoting Homeopathy, IFPH.
Sir, you can hear me now. I'm getting confusing actually.
Yes, we can clearly hear you, but you are not able to clear us because of the network. Your network is little bit weak.
Okay, just ಬರ್ತಾ ಇಲ್ಲ ಕ್ಲಿಯರ್ ಆಗಿ. ಸ್ಕ್ರೀನ್ ಬೇಗ ಬರ್ತಿಲ್ಲ ಯಾಕೆ?
ಪ್ರೆಸೆಂಟ್ ಅಂತ ಬರುತ್ತೆ ಸರ್.
Duration time. Present ಇಲ್ಲಿದೆ.
Yes, you can go ahead. With the blessing of Sushruta, father of surgery. Do you have any difficulty? Yeah, please unmute. Please unmute. Please unmute. You are muted. Your screen disappeared. Please reshare your screen. As it was there, but now it is not visible. Don't get panic. You just go ahead. If you find any difficulty, you can send it to me and we will share from our side. Do you find any difficulty in sharing? As you all know, that international session is for IFPH, International Forum for Promoting Homeopathy. IFPH is conducting regular sessions, and all the sessions, we have a lot of presentations from different doctors from different parts of the world. And we have seen some of the wonderful cures of surgical cases in this forum, and all those cases were brilliant. And Doctor, do you find it very difficulty in sharing? Ah, yes, it is coming down. Ah, yes, yes, it's already there. Yes, doctor, now you can go ahead. Everything is fine now. Yes, please unmute yourself and you can speak now. Okay. Yes, yes, it's moving from left to right.
Yes, sir. Because there is little bit technical error. I think I will follow with it. So
No.
please pardon me.
No problem. It is. It's all in the game.
Thank you all for wishing me on this wonderful day. And my special intention for today is
Again, your network is the problem. It is not your mistake. The network is not allowing you to continue. That's the reason why it is happening. Since your network is weak. Dr. Leta, can you hear me? Please unmute yourself and speak. Yes. You are a co-host. You simply, I made you co-host.
Yes.
Okay.
Yes, sir.
Can you hear me? Okay.
Yes,
Then-
I can hear you only. Doctors sharing of the screen. First time we can see, but next time it is not moving. Now the sound is also from.
Yes.
Uh,
Yes. Okay. That's enough. Please unmute. Dr. SHRISHAIL, don't worry, your network is making this problem, and this is not your mistake. Can you, Dr. SHRISHAIL, can you hear me? Please unmute and speak.
Yeah, yes, sir. Now I can hear you, but can you hear me? Okay, now it is clear. Okay, right. I'll start up, sir, because I think there is a technical error in this area. I tried with the two mobiles, even it is not connecting. Okay, right. Sorry for inconvenience. Thank you once again to all. I will start my session with the blessings of Shushruta, who is father of surgery. Also, before starting my session, I would like to pranam to my three heroes of my life, Dr. Samuel Hahnemann, founder of homeopathy, Dr. Amar Senika, my guru, and Dr. K.B. Biskupi, my father. Introducing myself, my name is Dr. SHRISHAIL KB. I am director and consulting homeopath at Sanjeevani International Homeopathy and Ayurveda, working in Bangalore, Mysore, and Mandya.
1 minute. Have you
I'm
shared?
Yes, sir.
Have you shared your screen now?
Yes, sir.
Hi.
Okay, is it clear now, sir?
We can hear you, but your screen sharing is not there now.
Okay, I think it is not taking now, sir.
No, it went away. There is no screen sharing now. You may restart, stop screen sharing and restart.
And link presentation.
Okay, now it is now it is there. Okay, you can go ahead with your presentation.
Yes, sir.
Okay.
Okay, sir. I will start with this possible way.
Okay. Now it is fine.
Yes, sir. With the blessings of Shushruta, I will start my session and taking the blessings from Samuel Hahnemann, Dr. Amar Senika, sir, and Dr. K.B. Biskupi, my father. I am going to my topic today. Introducing myself, I am Dr. SHRISHAIL KB. I am a director and consulting homeopath at Sanjeevani International Homeopathy and Ayurveda Center, working in Bangalore, Mandya, and Mysore. Sir. Sir, screen to mane. Just a minute, sir. Waiting.
Yes, it is fine.
Yes, sir.
Welcome.
Mobile control. Today's my topic is surgical cases treated with homeopathy. And these are my own cases, which I'm going to present in a shortest way possible. And I can share all the details if somebody needs from the same group. Initially, I choose the topic as surgical cases treated with homeopathy. But after working on it, I come to a conclusion, it is better to keep a topic name as scope of homeopathy in surgical cases where surgery is also contraindicated or surgery is contraindicated. So definition of surgery. Surgery is a branch of medical science which deals with art, practice, or work of treating disease or injuries or deformities by manual or operative procedures. So with the advancement of knowledge and technology, surgery has nowadays reached heights with increased much more success rate than ever. Without surgery, I think medicine is incomplete. But while giving this statement, I feel somewhere stucking at certain point that even with surgery, to certain limits only one, even with modern surgery, one is giving limited relief to the patient, which is expected, who is in a suffering mode. So I think modern surgery is facing limitations also due to even after doing surgeries, patients are coming with recurrence of the diseases like example, corn, warts, calcitis, renal stones, gallbladder stones, lipoma, or many tumors, or remaining so many disease conditions are there. And even it is limitation of a modern surgery when disease is dynamic in nature, where until and unless dynamic state of that individual is treated, he is not coming out of the disease state. So in this case, I think homeopathy starts its scopes from this point, where modern science says limitations, that is the scope of homeopathy. But one thing we have to accept and one thing we have to conclude that in emergency life-saving surgical procedures, modern surgery is playing a vital role, which we have to appreciate, which we have to accept the truth. I think surgery will be supreme successful stream of medical line if surgeon starts to use homeopathic medicines in order to prevent surgery and in order to give a health in a more pleasant way, as explained in our second aphorism by Dr. Samuel Hahnemann. Homeopathic medicines are useful pre-surgically, during surgery, or even after surgery. Homeopathy has scope, unlimited scope, where we can give wonderful relief to the suffering mankind. We can accelerate the process of healing. We can avoid the complications during surgery. We can help to reduce the effects of surgical, you can say, side effects. Even homeopathy has scopes and limitations in surgical cases. Though we are handling good cases of surgical cases, but it is definitely a truth that there is a limitation to homeopathy also. So we have to assess, we have to conclude we have to understand the limitations of our system, because in emergency surgical conditions where life is most important, death is so near, we should not stuck to our thoughts about medications or our themes about homeopathy that we can cure such disease. No, in such cases, homeopathy is not indicated. We have to take a decision here. Either it is possible to treat with homeopathy or not. If it is looking life-threatening or if it is a matter of life and death, definitely you should suggest it to the surgeons with modern science, which they can maintain better than us. That's the reason. First, I will talk about the limitations of homeopathy in surgical cases, that is in emergency surgical conditions or in absolute surgical conditions, means the conditions where surgery is the only hope, like myocardial infarction or acute injuries, RTAs or road traffic accidents, or any kind of injuries, major injuries. We have to think of the life first rather than system. In vital loss diseases where patient is vitally completely lost, his energy is no more, then we should not take a chance for homeopathy if it is indicated for surgery. So now I would like to talk scopes of homeopathy in such surgical cases. I think this is one of the best scope of homeopathy. When surgery is contraindicated in any disease or any individual person, that time homeopathy is having limitless scope, because that is the only hope. Because when patient is coming to the surgical intervention or advice, he would have completed or he would have taken all the prior consultations of medicine. So after that, only hope left is homeopathy. In such cases, definitely you have to make use of that situation and we have to help the needed, irrespective of system. So these are the few glimpses of my own practice or my clinical experience, which in short I will explain, and at the end I'm going to take one case in detail. So this is a first case of foreign body, glass piece in a foot or leg. With the help of surgeon's knife, that is silicia, I got result. That patient came with some foreign body touching to the outer surface after giving silicia. That glass piece which has went inside came out and removed without any incision. And this is a case of renal stone or kidney stone having a size of around 11 by 8 mm. And in my clinical practice, I'm having a success of up to 19 mm stone in a person. And this is a case of eyelid papilloma. We can see it in a girl, adult girl. I think why I say this is an important case for me, because during surgical excision, we know even after surgical excision, this eyelid papilloma is going to reoccur. But with homeopathy, you can see at the end, there is not a single scar left behind. And since last 4 years, I am observing this patient, there is no recurrence of the papilloma in that patient again. She is very fit and fine. But in this case, if you are suggesting for absolute surgery or modern surgery, there might be the chance of ciliary gap or hairline gap in between, which would be disturbed in a females. That too in India, it is more countable when a matter of marriage comes. So these are the cases of few more cases of renal calculi. I am posting so many renal calculi cases I see every day, but these are typical cases with varieties of stones we can observe. And this last one patient is of varicose vein who has underwent surgery for 2 times earlier. And when the doctor called him for surgery for the 3rd time, that patient has came to me and treated with the homeopathy. This is also eyelid papilloma, recovered very wonderfully. For earlier case, I used pulsatilla, and this case, I think I used this is a case of genital wart. This is a case of horny growth on the scalp. I used antium crude for this case, and this is a lymphatic swelling in the jaw region where doctors have decided to excise it and suspected a cancer. And now he is very fine. After 2 years, he's keeping follow with me without any medication. He's fine now. I used lycopodium in this case. After finishing in a very shortest way, I would like to come to my presentation case, which in hurried I had prepared a slide where I am presenting details in a video form and also in a written form. So this is a case of left spinopetroclival meningioma with mass effect on the brainstem. She is around lady of 52, 53 years old. She's having a severe chronic headache since last 4 to 5 years. She was taking treatment from various neuro consultants, and at the end point, after doing MRI, they have decided to undergo surgery. So there was a chance of major surgery complications also. That's the reason they were avoiding. At the meantime, patient sent to me with the only reason that patient is having cough and cold since last 1 week. So they have postponed for the surgery. They have postponed the surgery for 1 week. And in the meantime, they came to me along with acute consideration, acute case consideration. I took a detailed history and gave directly. I will go for the name of medicine so that you will get easily assessing the case. It's an arsenic album 30 potency I use it for this case. And after considering totality, next time giving the totality, I give arsenic album. After that, within 7 days, her cough, along with cough, she has explained about the reduction in her headache, along with severe giddiness, fatigue, everything is improved, and they have avoided the surgery. And it is 3rd year. She is in a regular follow up with me. Every 2 to 3 months, she will come, and she is very fine without any symptoms, as she was suffering very vastly earlier. So actually, I will show her video in a short. It is in Kannada. This is a lady, and this one is her husband. This is a file of Manipal Hospital, where they finally decided for surgery. Earlier, she went to so many other neurosurgeons, and at the end, at Manipal, they have decided for the surgery. So this is a surgeon's opinion about the surgery. So how reduction plan they are doing with vault open surgery. Vice President. So he's explaining, in short, I will explain it. So within taking a chance of 1 week where she was suffering with cold and coryza, in the meantime, they came to me, and after taking medicines, she has reduced her headache, and along with that cold and cough, everything, she was fine after 7 days, and they were decided to cancel the surgery. And the same surgeon told that when she is very fine, it is a major surgery, better we will avoid it. And after that, she is very fine. This is the detail about her complaints. Chief complaints are headache since last 3 to 4 years. Severe burning sensation was there. Sleepless. She was very sleepless due to her headache or pain. There is a typical giddiness that her husband has to support her while sitting or while lying down. There is a profound weakness. It is very difficult for her to do day-wise works also. There is a complaining of sweating cold on and off, and thermally she is chilly. She is thirsty, a small quantity of water for small intervals, and desire for hot water and desire for hot food was marked there. Considering her mind section, she is very anxious. She is very anticipating about everything. Even husband is not coming house. If something they have to do in a next couple of days, couple of weeks, she is to be very anxious. She's very fastidious lady, want all the time everything in a tidy way, in a perfect way. She's worried about her son, and there is a helmetic factor or causation is her anticipation due to disputes in the property matter. After that, she has developed the headache, and it's going worst day by day. And in this case, I used arsenic album 30 potency, first dose on first day, as next day again single dose. After that, she has told that, yes, sir, I'm feeling good and I'm getting sleep. So I stopped the medicine. After 1 week, again, I called for the follow-up. And that time, when she was a little bit worried about the surgery, or she was in a panic that if doctor is again sending me to the surgery. So considering that, I gave 1 more dose of arsenic album, and after that, no arsenic has been given. But in this last 2 years, she never has complained of all previous complaints, except whenever she is getting little bit nervous, she will be having mild headache, which she can manage without any medicines. And this is one of the best case I feel all the time. It is a second case of mine, which is peritonsillar abscess with multiple necrotic lymph nodes. This case also, in a hurried way, they came to me. Actually, he is a person or patient he was having a chronic complaint of hoarseness of voice and throat pain on and off. For that, he used to take regular medicine and all, but certainly he developed a high-grade fever. Even after 20 days of admission and regular medications during the admission period, he developed a fever with chills, with the total count was around 18,000 and 19,000. And then they have went for the investigations. After that, it was very confusing case for the surgeon also to decide, because sometimes it was etiology was showing tubercular, sometimes somebody was suggesting for the fungal etiology, and all the antifungals, anti-tubercular, antibiotics, analgesics, everything has been tried on this patient, but till he was having fever. And at that moment, with somebody's suggestion, he has came to me, and considering all his totality, and his symptoms were typically throat pain in right side, hoarseness of voice, and typical when he has came to me, that was a time of around 5 o'clock, and he developed chills in my clinic only. It was very horrible. So considering because of his high-grade fever, I could not able to take all his history, but I discussed with his wife and took his symptoms. Or that I got to know that he's very dominant person. At the same time, due to some loss after COVID, he's become panic, and at the same time he's irritable on the family members. All the time he is really aggressive, and he's buried or involved in himself, that he's not showing his real problem, but he's suffering inside only. So considering all these points, I gave him lycopodium 30 potency in a repeated dose for that night. Means 3 doses I gave. Next morning, I got to know that he's feeling better, and fever was little bit reduced. But again, 4 o'clock, I got call that little bit he's feeling feverish. Either he should go for the medicine or not. And I suggested him to take 1 more dose of lycopodium in a diluted dose. Means diluting in a cup of water and taking spoon of that. And after that, within half an hour, he was stable. And that was the day his fever went off, and he's fine. So this is his second video, which I did after, I recorded after 10th day, I think. So in Bangalore hospital, they were suggested for the surgery. In this case also, because abscess is collected, but one contraindication of surgery in this case was, if they are going to remove the abscess or that necrotic lymph nodes around that area, he may lose his voice, or he may suffer with aphonia in his future. That is the reason they were trying to avoid the surgery. But at the looking at his symptoms or severity of symptoms, they have decided for the surgery. But after giving lycopodium, he wonderfully recovered from that condition. And I think you can't listen the voice of that patient. Otherwise, one can easily differentiate the voice. Earlier, it was husky and very rough voice it was, and it is very fine afterwards. Today only has came for follow-up, and after 5 months, there is no recurrence of symptoms. He is very fine. So in this case, lycopodium helped me a lot. This is one more case. Actually, I could not collect the video of this patient, which I am having in my data due to time shortage and busy schedule. This is a case of renal calculi in a old age patient of around 68 years. He's having polycythemia vera. Actually, he's a patient to me. He was having severe burning sensation all over body, because due to polycythemia vera, his HB used to go to up to 24 mg per dl, or above it. Sometimes I see up to 28, 29. And at the moment of that scanning, when I for kidney stones, he has came to me, his total count was 36,400, and platelet count was around 5.5 lakh. And I have written here, polycythemia vera is a condition whereas the bone marrow goes into overdrive and make too many red blood cells along with too many white blood cells and platelets. And this increased state, there is a contraindication of surgery that patient may die on the operation table due to viscosity, increased viscosity or thrombosis formation, or there may be severe hypoxia during the surgery. So there is a risk for the surgery. And when he got the severe pain in abdomen, he went to urologist. After looking at his reports, he has awaited and he wrote some medicines. And when patient has came to me, I gave him Nux vomica in a 30 potency. Along with that, in this case, not to take a risk, I used hydrangea and berberis in a mother tincture form. So which has helped me a lot. And within 7 days, his pain, his stone has passed. Next day itself, his pain has reduced, and no fever was there on that day. After that, within 7 days, he came back. I sent him to rescanning as he was not having pain since last 1 week. And in that report, I got to see that there was no stone. And the same radiologist has called me, congratulating me, so that he was very happy, because in such cases where even modern systems can't help them, that time homeopathy has wonderfully helped. He was very happy with the case. And this is my hospital setup, Sanjeevani International Homeopathy and Ayurveda. And these are some cases which I have collected or which I have decided to explain in a very short. And I think with the disturbances I took today's seminar. Thank you all. Dhanesh sir. My cases explanation, usually I took 3 cases to explain in short. And there are so many cases which I have collected, but due to time duration, short time duration, last time I suffered a lot. That's the reason I took only 3 cases. If somebody wants to ask question or discussion, you can ask me directly. I will try to answer those questions.
Good evening, doctor.
Namaste, doctor.
Namaste. And I ask you, gallbladder stone, about that, the surgical need, and what are the advice management from your side?
Okay. Actually, gallbladders are very, I think in my practice, little bit difficult to treat cases, because there are 2 options. One, we have to think of their relief, and one, we have to think of removing the stones. And stones are very tiny. That time there is a chance of obstruction in the pancreatic duct. That is the complication we have to handle, which patient won't understand that situation. So usually in my experience, I give them medicines, but not with risk. I explain them directly that I will try my level best. If you are feeling better in 3 months, yes, you just continue. If you are feeling some unhappiness with the result, don't wait for, take another suggestion or go for the surgery. Because in 2-3 cases, I have seen obstruction or post-obstructive complications in my cases. So gallbladder usually I try to avoid with my own experience.
Okay, what are the medicine you try?
Madam, all usually if you are going for the constitutional remedy, all basic remedies will come. All like lycopodium may be there, chilidoni may be there, chimaphila will be there. So many you can't decide, or you can pulsatilla is there. Pulsatilla has given good result to me. In lycopodium, with the lycopodium, I given lycopodium to one post-surgical case. Along with that, before that surgery, she come out of this problem.
Okay.
So it is undecided, I think, with my experience.
Okay, thank you, doctor.
Thank you.
Doctor, any more cases you're sharing?
Yes, sir. I think
Do you want to share any more cases here?
Okay, shall I explain these all previous cases only?
One more case.
Okay.
Yes, yes, definitely.
Okay.
That's
This is a case of renal calculi. In this case, directly I will go to the remedy so that idea will be cleared with the symptomatology itself. It is a 11/8 mm kidney stone, and in this case, this patient already underwent once a lithotripsy surgery. So this is a second attempt for her, where urologist again suggested for the lithotripsy, and she's knowing all the consequences which she has suffered after first surgery. So she's trying to avoid the surgery, and she has came to me. And seventh day or sixth day, she has passed the stone without even feeling the pain. That is the best of this case. And this case has sent me so many renal calculi cases to me.
Okay. What are the medicines you are
Nux.
Naxo.
Yes, doctor. Nuxomic I used in that case.
Yeah, 30 potency or
30 only. Usually, we the followers of Dr. Amartya Nikam sir, usually we follow 30 potency only, because that will give you clinical follow-up hints very nicely, and patient will accept it very easily without any
Okay.
aggravation or without any other symptoms. So I think it is safer to use 30 potency, whatever may be the case.
Okay, doctor. Thank you.
This is a case of varicose vein. Hemamalis I used in this case. Very nicely, he's a chemist actually. He was using bandage all day. Every day he used to wear the socks or stockings, you can say. This is the color change you can assess after. Before it was deoxygenated blood, which was looking bluish, and this is the oxygenated, which is looking very fair, and edema is drastically reduced. Even this patient, he has went for the surgery for twice, laser surgery. After that, I had treated with Natramur. In this case, I used Natramur to this case, this patient. Natramur, emotional trauma, deep emotional injuries, grief which is unable to forget. Whenever you are taking the name or situation of that grief, rather than his lips, his eyes will talk more. His eyes will be filled with tears. That is the indication of Natramur in my view. And if that patient is hot, with closed eyes, we can give Natramur to the patient, which will never injustice with you.
Okay, doctor. And if there is any itching around the area of varicose vein and a discoloration,
Okay.
in that case, what are the medicines?
Pardon, madam?
The area of varicose vein
Varicose
around
vein, yeah.
that area having very dark color and a discoloration means
Okay.
blackish
Yes,
and
yes, yes.
severe itching. So
Okay.
what chilli patient, what are the medicines we
No.
can?
In that case also, there is no need to give specific medicine or special medicine for that, because when
Yeah.
varicose vein is there, that time blood is collected there. The venous blood is not going upside. That's the reason there it is collected there, and we are calling it as varicose vein. When the patient's condition starts to improve, automatic that impure blood is going to start upwards direction. That time it will change the color. So that time just you take detailed case and give constitutional remedy. Don't look for any other substitutional way to correct it, because it is not a cosmetic work to make it from outside. It is the internal medicine which will help a lot in this case. You can give external applications, but those are all temporary sake. Yes, even those medicines can help sometimes, but not to say happy results with those techniques.
Pardon?
Doctor, please close the share screen.
No,
Then-
it is the session is going on, but unfortunately, Dr. Lita Manohan asked such question. That's why it happened. Doctor, you want to present some more cases here?
Yes, sir, enough.
Whether you are going ahead with the presentation or you want to
Definitely, you can answer.
uh, Yes, whether we are continuing your discussion
No,
presentation.
sir. If presentation is over, if somebody asks to,
Yes, yes.
if somebody is asking question, I can stay.
Yes. Now we can. Then, what's your number of successful success in these renal calculus cases with the single remedy prescription?
I think, sir, very rarely I miss the opportunity to treat with homeopathy, because I think more than 85% I got success rate.
You are doing repetition every in a case.
I definitely will
Because
take the
I know
hint of
that,
not all the time I
Dr.
use
Lim-
repertory. Not all the time it is essential, I think.
Yes.
Whenever we are getting stuck at certain point, if you are not having a clear picture in front of our eyes, then at that moment I use the repertory and it will be grand generalized symptom.
Okay, just like Dr. Amar Nigam used to do.
Yes, sir. Same way, same way.
Sir is out. Sir
Because if you are
simply
what I observed is, if you are going for the shortcuts with repertory, then we are missing the depth of the cases or approach in depth to the cases, because we have to make repetition in mind. Then only conclusion should be taken from the repertory. If you are taking a serial of symptoms and comparing, most of this time, very minimum remedies comes to the end, where typical or PQRS symptoms will left behind, which can be the constitutional remedy for that patient.
that means that you are just using Metromedica for prescriptions.
Metromedica and repertory also we refer, but
Refer.
when we are opening the repertory, that time going to the differentiating with the Metromedica is the good thing what I learned from this, sir. Just go to the repertory, conclude, reach to the minimum number of remedies, then confirm from those selected remedies. We can then balance with the pathology, and each aspect we can balance in that case, thermally, pathologically, and generally we can tally that case thing.
Yes, Dr. Amarnikar sir used to do repetition also, and along with that, sir is giving more importance to the thermals.
Yes, yes, sir. When we are using the method of thermal, already Metromedica will be divided in 3 portions in our hand at the end of case taking. When we are reaching to the point of thermal analysis, that time chilly remedies, hot remedies, and ambithermal remedies, already our Metromedica is going to be very shorter. So in that case, comparing will be very easier, and we are reaching to the exact essential remedy to that patient.
What's your experience with the rare remedies in this sort of cases? Because,
Very rarely we use, sir.
You're always going ahead with this.
Rare remedies in very rare cases.
Yes. That's why.
Because when you don't have a clear picture, it is very difficult to, I think, use.
That's only a shortcut, I think. Yes. Then whether you are practicing that it is written that you are running a homeopathy clinic along with the Ayurvedic hospital. That
my wife is Ayurveda doctor, so together we have started the.
Oh, that's good. That's good.
And I think, sir, that is one of the question or one of the point hint to the society, that people are unaware of either it is homeopathy or Ayurveda. Just they are aware of the result. They need the result. They are asking for the result. In spite of Ayurveda, homeopathy, it is second point. But when they are coming to us, most of the time they use the word of Ayurveda, sir. Somebody has told that you are giving Ayurveda treatment, and we came for that reason. So I think when we are in a family, we both are doctors from the natural system. So together we have decided, and together we are doing the work.
That's
and
good.
it helps together, because whenever limitations to our systems, we can take the help of other system. It's not wrong at all, I think.
Yeah, there is nothing wrong with that methods, because our Indian government is also promoting a system with all the health stays under the same roof, so that everyone can utilize the opportunities there. Anyway, Dr. Hibbert is there. He is uploading our videos
Yes,
daily.
sir.
He want to have a chat with you.
Doctor, a very nice presentation, and you are very confident in doing the things.
Thank you,
That
sir.
is what
Thank you.
I'm very much
Robert, sir, thank you.
very much impressed. Do you use at the same time the Ayurvedic medicines and Ayurvedic method of treatment and homeopathic medicine at the same time?
Pardon, sir?
Yeah,
Do you use the Ayurvedic method and homeopathic medicines at the same time?
Usually won't, because in my experience, even if you're using it is never going to interact each other. Even with allopathy, even with homeopathy, Ayurveda, you can use it. And my observation is that whenever you are giving a sure shot classical, or you can say constitutional remedy, that result itself is explaining everything. That is the wonderful explanation by patient, that spontaneously they will explain the changes in their symptoms, which earlier they would have taken any system of medicine, but they will differentiate the, sir, this is the thing, I felt better after taking this dose, and I want that small dose only. That is the emergency dose usually I keep with the patients as their constitutional remedy selected, and they differentiate that point. Because in osteoarthritis cases or in pain management cases, I think it is not correct all the time to say, no, you have to take this homeopathy only. But rather than that, along with that, if you are giving any Ayurvedic supporting drug until to act this remedy, it is good thing, and they will, after certain days, they will come with good opinion for the homeopathy. And both are, I think, simultaneously help. They can help each other.
Do you consider the stage of the case, or altogether you take the symptoms and totality, go to the symptom totality, or you are taking the first stage of treatment of
Sir,
in the first you are doing the, what are the
earlier, sir, in the beginning
most
of my practice,
prominent symptoms?
yes, sir. In the beginning of my practice, each and every case of mine used to full for means 5 to 6 pages I used to take for each and every case. So pattern of case taking was a compulsory in earlier days. As day passes, with the experience, pattern will be same, but interpretation will go little bit speeder, and it is now taking means 2 pages it has came now. In that also, definitely I follow the methodology of Dr. Amarasya Nikam sir. Whenever I'm reaching final remedy selection, it will take around 5 to 10 minutes, 15 minutes for me to think over that remedy, think over that patient, managing both equally and giving the medicine, considering all balances in pathology wise, in thermal wise, in totality wise, everything it should be balanced. In some cases where I feel stuck, next day I will call for the remedy, and I will go for the re-analyzing the case and go for the remedy.
Good.
Oh,
Okay, thank you, doctor.
Thank you, sir.
okay, this is what Dr. Amar Nigam used to do, because we have a 2-day session at Cochin, some 20 years, 18 years back, and so I was there for 2 days presentation, and we have shown that beauty of homeopathy with the classical prescriptions by some of his cases. All the cases shown were brilliant, and only single medicine and single dose. Then he rarely repeat the medicine, but only. What's your opinion on the repetition of medicine, doctor? What kind of repetition you use?
Yes, sir, yes, sir. So as earlier I was telling to Dr. Hobart sir, I give indicated remedy or selected remedy in a half dram with the patient. So not to repeat frequently, but whenever they feel that patient is telling the same symptoms or aggravating, or earlier symptoms are reappearing, then that time they have to repeat it in first week, not after that. Because in first week we'll get to assess the case, we'll get to assess the result. So after second week, he will start to reduce the symptoms. Then no repetition after that. For first week, I will give the emergency dose. Otherwise, I will explain them to take the same dose whenever they are emotionally getting too much affected, if they underwent any shock or any kind of grief, any kind of their elementary cause or causation. So that time they can repeat the remedy. Otherwise, it is not essential. That too, deep occurring remedies usually we won't give repeatedly.
Okay, okay. Now it is the time to wind up the session. Now I invite Dr. Rambarisa sir to say total thanks to Dr. SHRISHAIL, who is celebrating his birthday in this day. So on behalf of, before that, Dr. Hibat will sing a birthday song for him.
Happy birthday to you. Happy birthday to you. Happy birthday to dear old and young Ram Parvesh sir. Happy birthday to you.
Thank you, thank
Energetic
you.
doctor, energetic doctor Pravesh sir. Happy birthday to you.
It's the
Happy
birthday.
birthday to
SHRISHAIL.
dear sir.
Thank you, sir. Thank you very much.
Birthday to
Actually, it is
you.
a real celebration by homeopathy
Thank you.
faculty, I think.
Thank you, Dr. Nanesh, Dr. Hubert. Very, very thanks and congratulations, Dr. Sri Sail Devi ji. Very nice, excellent presentation. Renal colic and kidney stone. Very, very thanks. Lycopodium and China 6X prevention of kidney stone.
Yes, yes.
China 6X. 1 week China 6X and other 1 week duration. Other China 6X, the very important remedy for kidney stones. Very, very thanks. IFPH, behalf of IFPH, very, very thanks, Dr. Sri Sail KVG. Again, presentation, IFPH. Thank you, thank you.
Thank you, sir. Thank you very much.
That's the end of the session, day 1374. Dr. SHRISHAIL, really, we are very happy to celebrate your birthday in this way at this International Forum promoting Homeopathy. Thank you.
Special thanks to you, sir. Ganesh, sir. Thank you very much.
Thank you on behalf of all those here in this forum who are watching the session in the YouTube tomorrow from onwards, and thank you once again. Those who
Thank you, sir.
participated in the session also. With that, we come to the end of the day, 1374. It is over to Dr. P. Shaila tomorrow in the Malayalam session. Thank you all. Good night.